common question people have regarding rotator cuff tears is how long does shoulder surgery take? And so that varies a lot. It depends on the type of surgery, and it also depends on the surgeon. I just recently read an article in the Shoulder Journal, and it looked at 32,000 shoulder surgeries. Now this was replacements, not rotator cuff repairs, but shoulder surgery. And the average time was 2 hours. But what they were looking at was infections, and what they found was very simply that the longer the surgery it took, the more infections patients got, right? So surgical time is very important, right? So we'll start there. And how long does it take? Most surgeons that do shoulder surgery take around 2 hours to do a shoulder surgery, right? That's what this article showed. That was for replacements. For rotator cuff repairs, I would say it's probably around an hour and a half to 2 hours for most surgeons. In our practice with me, we take less than 30 minutes, right? We take less than 30 minutes. And I've always strived to be a very efficient surgeon because, you have this path that you're trying to take. You have someone that has a problem and you need to fix that problem, and you need to do it. You need to do a fantastic job and do it well. But along that path, you need to figure out ways to make the process more efficient, because what we know is that the longer you're asleep, the longer that procedure, the more infections you can get, which is the number one risk of all surgeries is infection. Number two is you're asleep, and the more risk you have from anesthesia, right? So more risk from anesthesia, more infections, the longer you're asleep. So we do almost all of our rotator cuff repairs take less than 30 minutes now, regardless of the complexity of what we're doing. Same thing with our shoulder replacements. And how do we do that? Well, a couple things. One is just massive amounts of repetition, right? So we do over 700 shoulder surgeries a year. Many surgeons that do them are doing around 100. You should always ask your surgeon, how many of these do you do? We do 700, which is more than 99% of surgeons. I've got a wonderful team of associates who operate with me. I'm still running the show and doing the surgeries, but they're assisting me and helping me. So that's a big part. And then the technologies we use, where we use the newest, highest state-of-the-art technologies and tools and techniques to get your rotator cuff repaired. And we've come up with several techniques that have allowed the surgery to be much more efficient, right? And also, getting an incredibly strong repair. So in my practice, I've always, been driven to always get excellent outcomes. That's the sine qua non. Like, that can never ever be not the number one goal, but then the number two goal is, how do I get that amazing outcome, that amazing surgical repair in the shortest amount of time? Because I want to minimize my infections. I want to minimize how long that patient stays asleep, right? And so we always strive to keep on ticking away at that. But yeah, so for most surgeons, again, around 2 hours. For us, in our practice, it's roughly 30 minutes.